Hello there. Happy to be with you on this Sunday. Provinces are battling record high levels of COVID infections, putting increased strain on overburdened healthcare systems. On a call this week, premiers pressed Ottawa for more support. In that meeting, the Minister of Intergovernmental Affairs, Dominic LeBlanc. I spoke to him earlier about some of the province's demands. Minister LeBlanc, good to see you.
Good morning, Rosemary.
Last week in a press conference, you talked about how the federal government obviously will do and has done many things to help the provinces and territories, but you also said that there's not a limitless number of federal resources. Are federal resources, would you say, stretch further than they have been at other points during the pandemic?
What we're seeing, Rosemary, which we hadn't seen in previous waves of COVID, is obviously an increased number of infections, which puts pressure, as we've seen across the country, on provincial and territorial healthcare systems. And many provinces at the same time are requesting more and more federal supports. Obviously, our job is to do whatever we can to support them. We're confident that we're in a position to respond to those requests. But unlike previous waves, they're sort of all coming at the same time. But we had a very, I think, constructive and positive conversation with premiers last Monday evening. We talked about how the Government of Canada would continue to be there to support them. And they talked about the challenges in each province and territory and where they thought the Government of Canada could be supportive. So we're very confident that we'll be able to do whatever is necessary. But like any jurisdiction around the world or across Canada, these are tough weeks. We're in very tough weeks now.
So have you had to refuse a province support, or because you're sending this message to provinces, have they sort of sorted it out amongst themselves in terms of who needs the assistance most urgently?
Yeah, obviously, Rosemary, we're not going to refuse to do whatever we can to help provinces and territories. And the good news is it's a very active conversation between federal officials at the Government Operations Center and their counterparts in provinces and territories. These are literally daily, in some cases, hourly conversations that are updated in real time. So we have a very good line of sight on what particular provinces and territories are thinking in terms of what might be their needs and where the Government of Canada might be able to support them. The one thing, Rosemary, we've talked to provinces and territories a lot about, obviously, is increasing as much as we possibly can, access to rapid tests, to vaccine boosters. We're hopeful that the therapeutic antiviral treatments may be approved soon, and we'll be in a position to send, if their approval is given, initial doses to provinces and territories. So, frankly, the conversation with premiers last Monday evening was extremely encouraging and collaborative.
I want to talk to you about the rapid testing, because I know that you have said you plan to deliver 140 million rapid tests by the end of the month. But many provinces, almost all of them, say that they are encountering delivery problems or they're not getting delivery dates. BC, says it's asked for 19 million, has not had confirmation when they will come. Quebec, Alberta, Manitoba, the list goes on. So what is the holdup? Is it the acquiring the tests by the federal government, procuring them? Or is there some issue getting them to the provinces?
Well, there certainly won't be an issue, Rosemary, in getting them to provinces and territories as soon as they arrive in Canada. We don't have a very robust domestic supply yet of these rapid antigen tests. There's a Canadian company for the first time that's in a position to deliver some to Canadians now. So we're very confident that we'll have 140 million in Canada in the month of January. We got 35 million last month in December alone to provinces and territories. But the challenge we have is, and it's seen around the world, is we don't have as firm and as clear a line of sight on the specific delivery dates that we would like. Right. As soon as we get that information, of course, we share it with provinces. But we're confident that over the next weeks in January, we will have 140 million rapid tests in the hands of provinces and territories by the end of January.
The other thing that you mentioned there, of course, that everyone's struggling with right now is capacity, and that leads provinces then, and I know it happened on the phone call last week, to want to have a conversation around healthcare funding. The Prime Minister told me before Christmas, fine, happy to have it, but not right now. I'm wondering, though, whether this recent wave that we are dealing with has not proven the point that provinces have to some extent, that even with the $63 billion you've given them to help fight a pandemic, there is still not capacity. And that sort of makes the argument that this conversation needs to happen quickly.
We'll continue to do whatever it takes to ensure that provinces and territories have the resources they need to fight COVID, to support their public health care systems in every way possible. We've also said we recognize that the Government of Canada should increase the transfers to provinces for long-term sustainable world-class public health care. But we've also said that there should be a greater transparency and greater data in terms of the results that provinces achieve for those investments. So we want to make sure as COVID, the urgency of COVID subsides, and we have those conversations with a view to increasing federal transfers. Prime Minister has said he's prepared to do that as COVID subsides, when COVID is behind us. But what we want to do, Rosemary, is ensure that the right transparency is in place so that the patients, the citizens, the residents of these provinces and territories actually see improved healthcare services, that the shortage of healthcare professionals that is stretching provincial and territorial healthcare systems is alleviated. So we're prepared to continue to have those conversations.
Lastly, let me ask you about this tax or premium that Quebec has floated to put on unvaccinated citizens there. I know we don't know many details yet, but I wonder if the Government of Canada or you in your capacity have reached out to the Government of Quebec to understand what exactly they're considering, whether this is actually just a trial balloon to try and encourage people to get vaccinated, or how you're reading it.
So we don't have the details, Rosemary, of the particular proposal. We saw the Quebec government refer to it last week. I have ongoing discussions with Quebec ministers. We recognize that provinces are, within their own jurisdictions, doing what they think is in the best interest of increasing vaccine uptake. You've had right across the country a series of different measures. The provinces aren't all doing the same thing to encourage the greatest number of Canadians to get vaccinated, because that, as we know, is the best way out of COVID-19. We'll continue to do our part in our jurisdiction and continue to support provinces as they try and drive up the numbers of people vaccinated.
But do you think that this is a sort of an extreme proposal or an extreme measure, or that it is worth considering?
Again, Rosemary, we don't know the details of this particular proposal from the government of Quebec. We have seen provinces at different times in the pandemic take different steps to increase the number of citizens in their jurisdiction, residents in their jurisdiction that are vaccinated. So we'll continue to ensure that provinces have adequate supplies of vaccines. That's the role of the federal government. And within our own jurisdiction, as I said, we're prepared to take tough measures to impose vaccine mandates in areas of federal jurisdiction, and we'll continue to do so.
Okay, Minister, got to leave it there. Thank you for the time. Always appreciate it.
Well, thank you, Rosemary. Have a great day.